Standard Operating Procedures, Part 4, Linkage to Care and Other Resources. Linkage to care for HBV and HCV positive participants. There are 6 steps to follow. Step 1. Review participants' results. Look at the exported spreadsheet to find participants who tested positive. Separate B from C. Identify individuals who may need HBV vaccination. Step 2. Call participants. For B-positive participants, use the cascade of questions. Determine if referral is necessary for primary care provider or recommend participants to see their current physician. Recommend HBV vaccination if needed. Step 3. Assess participants' access to care. Determine participants' ability to pay for treatment and assist with patient assistance programs when qualified. Step 4. Find resources for participants. Find facility to monitor participants' treatment and find opportunities for support path. Participants pay for doctor visits and blood work 4 times. HBI helps participants fill out the form to get medication. Refer to NIH as the last option. Step 5. Identify other resources needed. Follow up with patients on their resources that they need based on their response on the registration form. Step 6. Follow up with referral partners. Follow up with UMD and NIH, or follow up with participants only when recommended by UMD and NIH. Identify participants who need HBV vaccination. After test results have been confirmed, those who test hepatitis B surface antigen negative, surface antibody negative, and core antibody negative will need HBV vaccination. Results will be mailed to participants, which will include information on where to go to get HBV vaccination. Recommend 2-dose vaccination in 4 weeks for adults using Dynavax Heplisav B. After 2 weeks of mailing results, follow up with participants to see if they have been vaccinated. Follow up 2 more weeks after the first call. Here's a suggested phone call script for Linkage to Care. You can introduce yourself by saying, "Hi, my name is," and I'm calling from HBI. May I speak with? Confirm you are speaking with the correct person by verifying their first and last name and the date of screening event they attended. If the patient doesn't seem to understand, you can ask what language they speak, or if they give you permission, you can speak with their relative. If there's no one, then you can use the language line. You can follow up by saying, "I have your blood test results. Do you have time right now to speak with me, or would you like me to call back at a better time?" The patient will let you know when you should call back if it is not a good time for them to speak to you. This flow chart illustrates how you can communicate with someone who tests positive for hepatitis B. You should work with the Linkage to Care specialist for more information and guidance on how to work with individuals who test positive for hepatitis B. Here's a suggested phone call script for those who test positive for hepatitis C and need Linkage to Care. You can start by saying, "I have your hepatitis C results here, and it says that you are positive for hepatitis C. Did you know that you have hepatitis C?" If the participant answers yes, then you can ask or say any of the following. "About how long have you known? Do you know how you got it? Are you seeing a doctor? Just for our records, what is your doctor's name? Are you being treated or taking any medications? Can you tell me the reason you are not taking medications? Do you need help finding a doctor or getting medications? Do you have any questions that I can help answer? Here's my name and my number. Please give me a call if you have any questions or need any help. Is it okay if I call and check on you every few months? Thank you so much for your time." If the participant answers no, then here are a few things that you can ask or say. "Okay, well, hepatitis C is a virus that affects your liver. Fortunately, this hepatitis is curable, and with the proper monitoring and treatment, you can still live a long and healthy life. It is mainly passed on through blood, like from a mom to her baby. Do you have any idea where you could have gotten hepatitis C? Here's a suggested phone call script for additional linkage to care. You can ask, do you have a doctor and/or insurance? If the participant answers yes, then you may ask or say any of the following. Do you need me to help you make an appointment with your doctor? Please remember to bring the results to your appointment. Do you have any questions that I can help answer? Here's my name and my phone number. Please feel free to call if you have any questions or need help. If the participant answers no, then you can ask or say, would you like to see a doctor who's willing to see uninsured patients who are willing to pay out of pocket? If they say yes, you can refer them to a primary care provider who is willing to see uninsured patients. As a last resort, you can also offer them to see someone at the NIH. You can say, if you are not able to afford seeing a doctor without insurance, then we are able to refer you to the NIH, who is willing to do the lab testing. However, you are responsible for getting to the appointment. With your permission, we will fax NIH your information to be reviewed and approved by the department doctors. Then, their patient care coordinator will contact you to schedule an appointment and give you the details on how to get there. HBI will also help you apply for the Gilead Support Path program, which helps patients get the medication they need. You'll be responsible for filling out the patient portion of the forms and providing the necessary documents. You should have the forms and documents ready before you go to the appointment and bring them with you to give to the doctor at their office. The doctor will be responsible for filling out the doctor portion of the forms. The office will fax the forms and HBI will help coordinate. You should also ask for an email address where we can send the forms and the information on what documents are needed. If the patient is interested, then ask them for permission. Again, just to make sure, for us to refer them to the NIH. The Linkage to Care coordinator will send them an email with the forms and information for applying to the Support Path program. HBI has a language line account. This resource is used so that we can access language interpreters that do not speak any of the languages that our staff or volunteers speak. If you need to use the language line personal interpreter, you may dial their phone number and enter the 8-digit PIN number when prompted, and then ask for the language that you need. There is a cost associated to this service, so the actual PIN number can be provided by the program manager once there is approval to use the service. Program participants may need additional assistance or resources that HBI does not directly provide. Please use the findhelp.org to assist these individuals. For more information about our program and services, please visit www.hbi-dc.org.